So is it a good time to be in health informatics?
I think now is a very interesting time to be in health informatics. If you look across society about where IT plays a role, this is one of the big areas where there's a gap between what we can do with today's technology and what is being done. And that for anyone who cares about their family, their friends, growing old, how we manage health and care needs to radically transform in order to not be too expensive and just to deliver for all of us. So the question in my mind is, if you come into health informatics now, if you're working in health informatics, can you make a difference? And I think for various reasons we've got the opportunity of a generation to make some fundamental changes. Critical to how we change things in health and care is actually getting people to work together. So people in IT cannot do anything in isolation. People in IT cannot make a decision that has a clinical impact without having those people who understand those impacts involved. And that the best teams that I've seen are ones where everyone brings their unique skill set into the room and the barriers go down, so everyone is working together on solving the same sort of problem. And it feels to me, I can see evidence that we have some of those barriers sort of, if not completely broken down, but weakened in ways that they've never been weakened before. That there are people who, with strong clinical backgrounds, who are seeing information as the place where they can make the most difference to their patients, to people in their care. I'm seeing people in technology who are starting to develop that symbiotic relationship with people like that. These are the kind of things that change culture and change the way organisations operate. And that, I think, is what's the real opportunity. Because at the end of the day, the technology isn't actually the interesting thing. The organisation isn't the interesting thing. It's the journeys that people take through as patients and in care, and how the technology supports that. And that requires that multidisciplinary approach.
So what can BCS be doing to help?
So BCS has an often misunderstood role here, because I think that on one level BCS is just the people working in this sector who share a common set of values. We provide an awful lot of useful functions, but at the end of the day, the reason that BCS matters for this is because we've got a clear purpose that people can come together underneath. There are few places where you can get people working in informatics coming together to just answer the question, how can we do it better for the public? I think that's really important, and I think that the more people in health and care understand that opportunity and that open door to have that conversation in BCS, the better it will be. And that what I see now is that in leadership within BCS and in leadership across health and care organisations, we've got a new set of people whose values are aligned like never before. More and more I'm in conversations with people where they don't care so much about their organisation, they don't care about their career. What they're passionate about is making a difference. That is what BCS stands for. Those are the kind of people that BCS wants to support and highlight and grow and develop. And I think that getting people to understand that that's what we're here for, that if you are like that, we're here for you, and that you're here for each other, that's the core of what BCS can do. Now that can sound quite fluffy, but actually when you get down to local delivery in organisations, often our organisational barriers, our tribal barriers are what hold us back from really working together. And I think that BCS can be that third space that you can have that conversation in, that helps people to move past those issues. So much of what holds us back in health and care is to do with organisations and people. And so much of the value that BCS can add is getting people to work differently. So this is a critical element, I think, just one piece in the jigsaw, but a critical piece in ensuring that in future, health and care is organised around the person. BCS has a role to play here with all the people who want to do that.
And how does the UK government fit into the health informatics space? Do you think that the UK government could be doing more to help?
So I think it's almost as though we have demonstrated in the past 20 years that government is good at some things and not good at others, and that I think that a lot of what has happened in the last couple of decades on health IT has not worked as people had expected, but from very good motivations. And I think what we're looking for is a kind of a role for government and policymakers to be part of that community and play the role that they have to play as best that they can. So there's very little that is truly political in health informatics, and most of it is just about what works. And that if you get policymakers, people in key decision-making positions, who understand that and understand their role and how they fit with other people, that's when they're effective. There's very few people who want IT to do a bad job in hospitals. There's very few people who want to put their own needs above other people. Actually, at the end of the day, what we need to do is give people the opportunity to do the right thing at all levels throughout the organisations, from government through to your local GP practice.
You've obviously spoken to loads of health informaticians over the years. What one bit of advice would you give to someone who's thinking of making the journey into that particular sector of the IT industry?
So, I mean, it's not one sector, it's lots of organisations. I think that if you're going to make a move in, look at the leadership and the culture in the organisation that you're going into. The difference between organisations that are grindingly obnoxious to work for and amazing is down to whether they have a leader who can stand up and inspire people, and a culture on the ground of people who are empowered and can get on with the job. So what I would say to people is that if you want somewhere where you really can make a difference to the world, health informatics is a fantastic place. Choose the place where you're going to be empowered. And it's not difficult to tell if an organisation is full of slopey shoulders and misery. And that's not a good place to start out. For leaders, you've got to take those slopey shouldered places and you've got to turn them around, but that's a different challenge.